typical structure that I taught you before. In this model, and after that in cadaver. This model shows you the sagittal section of the oral cavity, nasal cavity, and pharynx. Let's start with the oral cavity. If you remember, I told you the oral cavity. We can divide the oral cavity into two parts.
Two parts: vestibule and vestibule proper.
Vestibule and oral cavity proper. This space is vestibule. Actually, vestibule is a narrow space between the teeth and lips anteriorly. So this space here is vestibule, and the remain parts are the oral cavity proper. At the oral cavity proper, you can see this structure, actually the lingus or tongue or glossus, yeah. And in this model, you can see some fibers of the. Actually, in this model, you can see some intrinsic and extrinsic muscles of the tongue. For example, here at the most superior part of the tongue in this model, and I think this one, you can see some longitudinal fibers. These are superior longitudinal muscles. Fibers of the superior longitudinal muscle of the tongue, one of the intrinsic muscles of the tongue. And you can see these fibers. Actually, these fibers are originated from here, from this bony projection at the posterior surface of the mandible. Look at this mandible and this one. And this is the anterior surface of the mandible, of the body of the mandible, and this surface is posterior. Yeah, at the posterior surface, you can see some bony projections that are origin of some muscles. One of these muscles is genio. This muscle, actually these fibers are related to the genio muscle. This muscle is originated from here. The name of this bony projection is genial tubercle. Genial tubercle. So, and spread out throughout the tongue, throughout the lingus. So these fibers are fibers of the genio muscle. Look at this muscle. Look at these fibers.
Inferior.
Inferior.
No.
Inferior genio hyoid.
Inferior longitudinal.
Inferior longitudinal. The origin of this muscle is posterior surface of the mandible, okay? And the insertion is here. Actually, the bone that's located at the superior part of the neck. What is the name of this bone?
Hyoid bone.
Hyoid bone, yeah. So the name of this muscle is genio hyoid muscle. It's not related to the muscle, extrinsic or intrinsic muscles of the tongue. It is actually the muscle that form the diaphragm of the oral cavity. So this is not one of the muscles of the tongue. It is actually one of the muscles of the oral cavity. Okay, I told you before, one important structure divides the tongue into two parts, anterior 2/3 and posterior 1/3. What is the name of that structure that divides the tongue into two parts?
Terminal sulcus.
Terminal sulcus, yeah. And can you show me in this model terminal sulcus? Exactly, yeah. This line represents the terminal sulcus or sulcus terminalis. So this part is the oral part of the tongue, and this part is the pharyngeal part of the tongue. You know, the other name of the posterior 1/3 of the tongue is the pharyngeal part of the tongue, and the other name of the anterior 2/3 is the oral part. So you can see in the pharyngeal part or posterior 1/3 of the tongue, you can see some projections. And what are these projections?
Lingual tonsil.
Exactly, yeah. These are lingual tonsil. You can see lingual tonsil at the pharyngeal part of the tongue. In this model, you can see the anterior 2/3 projections of the tongue in this model. Okay, look at this structure. This is the roof of the oral cavity. And which structure make actually roof of the oral cavity? Hard palate. Hard palate. Some bones. This is the hard palate. Actually, this structure, these four bones actually form the roof of the oral cavity. At the posterior side, you can see the palatine bones, and the anterior side, you can see maxillary bones. Okay, pay attention to this structure, this foramen, at the most anterior part of the hard palate. Can you remember the name of this structure, this fossa? No? No problem. This is the incisive fossa. Incisive or incisive fossa. And can you show me the incisive fossa in this model? At the hard palate. At the anterior part, most anterior part of the hard palate. Yeah, this structure. This line represents the incisive fossa of the hard palate. And the posterior most posterior part of the hard palate, you can see this muscular structure. Yeah, this is the soft palate. And the other name of this part is uvula. Uvula. Okay, we can say this is the uvula, or we can say this is a soft palate. Look at this structure. This is the lateral wall of the nasal cavity. Yeah, lateral wall. How can you find the lateral and or actually middle wall of the nasal cavity? Septum. Nasal cavity has three walls. Yeah, two lateral walls and one septum. Yeah. How can you actually differentiate these two types of the walls, lateral and septum?
Septum is flat and
exactly. Yeah, septum. Can you give me this model? Salam. Thank you very much. Model. Look at these two models. This is the septum of the nasal cavity, and this is the lateral wall of the nasal cavity. You know, the septum is flat, but lateral wall has some projections. And the name of these three projections are concha, yeah, and just inferior to the each concha we have meatus, yeah. So this is superior, middle, and inferior concha, and we have superior, middle, and inferior meatus, just inferior to the concha, yeah. I need a breathe. You know, we have somehow a small space just posterior to the nasal cavity and oral cavity and larynx. You know, this is the nasal cavity, the oral cavity, and the larynx. And the space just behind these three structures is pharynx. We can divide in anatomy, we can divide pharynx into three parts. Yeah, this part is nasopharynx, actually just behind the nasal cavity from the skull, actually the base of the skull, or this one. What is this one?
Sphenoid.
Yeah, and this is the sphenoid sinus, yeah? Sphenoid and sphenoid sinus. From this one to uvula, I mean this space is nasopharynx. From uvula to the tip
Oropharynx.
to the tip of the, please, to the tip of the epiglottis is actually oropharynx. And
Then we have
inferior
laryngeal.
to the tip of the epiglottis we have laryngopharynx. Yeah, and we have two important structures in the nasopharynx. This one and this foramen. The name of this structure is
Plateau.
actually this structure is attached to the roof of the nasopharynx, or we can say is attached to a sphenoid bone. What is the name of this structure? Pharyngeal tonsil. Pharyngeal tonsil or third tonsil, and you know the name of the this tonsil in pathological condition is adenoid. Yeah. So this is the pharyngeal tonsil, and we have another structure, another important structure in the nasal cavity. I mean this foramen.
Opening a station tube.
Opening of eustachian tube or auditory tube. And can you tell me actually another name of the eustachian tube?
Auditory tube.
Auditory tube, eustachian tube, and because this tube communicates pharyngeal nasopharynx
To the middle ear.
tympanic cavity. So the other name of this structure is pharyngotympanic here. Okay, we have three folds, mucosal folds, just around the pharyngotympanic or eustachian tube. I mean these two folds, this actually short fold, and this long fold, and just at the superior part of the foramen we have another fold. We have another mucosal fold. Can you remember the name of these three folds?
Salpingopharyngeus, glosso,
palatine, and torus tubarius. Yeah.
this one is torus tuberous.
The other name, one of the names of the eustachian tube is salpinx. Okay. So this fold is originated from salpinx and inserted to the soft palate. So the name of this fold is this short fold is salpingopalatine. And the other fold, mucosal fold, is here. It is originated from the salpinx and inserted to the wall of the pharynx. So the name of this structure is
Salpingopharyngeus.
Yeah. And we have mucosal fold just superior to the eustachian tube, opening of the eustachian tube. I mean this fold. The name of this fold is torus tuberous. Yeah. Okay, and at the oropharynx, we have two important structures. In these two models, please give the model your classmate. Okay, in this model, in this model, we can see a projection just inferior to the tip of the uvula. Look at this model. I mean this structure. Actually, we have another tonsils in each side of the oropharynx.
Palatoglossal.
Palatine tonsil. So this structure is palatine tonsil. Pay attention to these two models. Actually, we have two folds. Again, we have two folds just anterior and posterior to the palatine tonsil. The anterior fold is palato-glossus. Actually, the other name of this fold is isthmus of the oral cavity. And at the posterior side, we have another fold. It is originated from soft palate and inserted to the pharynx. So the name of this structure, this fold is palatopharyngeus. Is actually larynx. You can see some cartilage of the larynx. For example, this is the thyroid, and this one is no. This one is
epiglottic.
In the laryngopharynx, in the oropharynx, you can see a very small space between the tip of the epiglottis and most posterior part of the tongue. I mean this space. The name of this space is
vallicula.
And what is the importance of this structure? This actually, this was my question, and you can ask my question. You can answer. You can send me your answers. No. Okay.
You didn't see.
I will check.
You don't have time.
Narrow space is esophagus, and this space is trachea. Actually, the continuation of the larynx. Okay, finish.